We are now pleased to be joined by City Public Health Disease Prevention Clinical Services Manager Karen Stanley. Welcome to the show, Karen.
Thank you very much.
Well, you know, we hate to think about it, but summer's winding down, and even though, you know, it's like I said, hard to think about, flu season is upon us. Why don't you start by talking a bit about the typical time frame of a flu season?
Well, I'm not sure there is a typical time anymore, but as far as what we used to see is we would see a lot more flu in November, December, and January. And now it seems to have typically moved more to February and March that we actually see the most cases. However, we still vaccinate in September, October, and November primarily, and then continue on through the rest of the season till probably May.
Really? So those are just kind of peak seasons, but you can get it anytime?
You can get it at any of those times, right?
See, I was one of those weird ones. I got it in July, of all times. Well, we know that the flu is bad and that it makes people sick, but why is it different every year? There's not just one flu vaccine that you can get, you know, that'll last forever. Flu is different every year.
Well, we hope there will be a vaccine that will be able to cover all of the different viruses, but at this time the viruses do change periodically, and sometimes there's a major change and sometimes it's just a minor change in the type of virus that's circulating. And so the flu shots have different types of viruses that they're trying to prevent depending upon the year and what's circulating during that year.
Okay. Well, one problem that public health officials are constantly countering is myths about the flu vaccination. And Karen is now going to address some of the most common myths that she comes across when it comes to people not wanting to get a flu vaccine.
In most cases, we don't think of the flu as being a serious disease. It's very uncomfortable and people can be quite miserable with the flu, especially when they have muscle aches, headache, fever, and nasal congestion, cough, and whatever other symptoms they might have. However, there are a number of people who do have very serious complications to the flu and may even die from the flu. The greatest number of hospitalizations occur usually in the children who are under 2 years of age and persons who are 65 years and older. So it can be very serious for those people. Also, there are people who have underlying health conditions, and it can be a serious problem for them as well. The flu shot can't cause the flu. It is an inactivated vaccine, so it's a killed virus. Killed viruses can't cause the flu. However, there is the nasal spray, which is a live attenuated vaccine, and it does have a live virus component, but it is scientifically engineered so that it cannot cause the flu either. Some people think that the flu shot doesn't work because they may end up getting the flu anyway. The flu shot is not 100% effective, so there are some people who will not develop the immunity or who may have reduced immunity even though they had the shot. There are also people who are confused by the fact that they may get a flu, whether it's the type of flu that's in the flu shot or not. And so they attribute that to the flu shot not working. And then also people may end up just feeling like, you know, they may have the muscle aches and the fever, slight fever following the flu shot. And that can just be a side effect to the flu shot. The side effects are usually pretty minimal with the flu shot or with the nasal spray. The nasal spray most often produces just kind of a runny nose. It may cause a sore throat in some people. The flu shot is generally a sore arm. Once in a while there might be a little bit more general malaise or just not feeling well after they've had the shot. But the serious side effects from the flu shot are about 1 in 4 million people. So it really, generally is pretty mild. Some people think that only the over 65s need a flu vaccine because in the past we primarily concentrated our efforts on the people who were older. However, again, as I mentioned before, the hospitalizations may occur mostly in young children or persons over 65. So children up to age 2 can be at some risk. The 6-month-olds and older are all recommended for the flu shots. And so we are trying to immunize everyone that we possibly can at this point. That is definitely a myth. We do try to do most of the vaccination in September, October, and November. But however, if the person has not gotten the flu and if the flu isn't really present in the community, they can still receive their flu shots all through the rest of the year, actually. And the vaccine is good until the end of June. And last year we did end up vaccinating a few people in April and May.
Well, now that we've spent some time countering some popular myths about the flu vaccine, Karen, why don't you tell us how we can prevent the spread of germs in general?
Well, the best way is hand washing. Hand washing serves as a great deterrent for disease transmission. And so we always encourage people to wash their hands. If somebody is coughing, they should cover their cough. And there are posters posted everywhere about that, so I think people are pretty aware of it. Also, if someone is ill, they should not go out and be around other people. If somebody knows that another person is ill, it might be a good time not to see that person. And so just generally taking care of oneself with exercise, nutrition, and so forth also helps to prevent people from getting any kind of an illness, probably.
Absolutely. Now, what is the city offering? We're obviously taking a big stand when it comes to trying to get everyone vaccinated. Where can residents come and see you or other people that work for public health and get their flu vaccine?
Well, if people are interested in coming to public health, we do have clinics, regular immunization clinics on the first and third Tuesday evenings from 3 to 5:30. And we do see people for flu shots during that time. We have other immunizations going on as well, but we do a lot of flu shots too. And then we do have community clinics. They can always call our main line and get information about any community clinics that might be coming up in the area.
Perfect. Or visit the city's website. And that information is available on the public health page. We'd like to have a big thank you to Ms. Karen Stanley for being here with us today to discuss ways you can protect yourself from the flu this season.